Good morning, it's Michael Mallison again from the Canadian Spondylitis Association at the Canadian Rheumatology Association annual meeting, reporting from Speaker's Corner for Arthritis Broadcast Network. My guest this morning is Rhona McGlasson of Bone and Joint Canada. So, thank you for coming, Rhona. Maybe you can just introduce yourself and tell us about your role in rheumatology.
So my name is Rhona McGlasson. I'm the Executive Director of an organisation called Bone and Joint Canada. I'm a physiotherapist by background and have been working in the context of rheumatology around osteoarthritis and some evidence-based programming around the management of hip and knee osteoarthritis.
That's a perfect segue into my next question, which is tell us all about the GLAD program, what it stands for, what it is.
So the program that we're currently implementing across Canada is called GLAD, G-L-A-D, and that stands for Good Life with Arthritis from Denmark. So this is an evidence-based program for people with hip and knee osteoarthritis that has been launched across Denmark and currently has had over 20,000 people in Denmark go through the program. The results there have been quite astounding with the reduction in symptoms for individuals of 32%. We have licensed the program to Canada through Bone and Joint Canada and are currently implementing it in Canada. We have translated it, put it into a Canadian context, have launched already in Ontario and in Alberta, are launching it in British Columbia next weekend, and are starting to see patients actually go through the program and have similar outcomes as they're having in Denmark.
Great. And what are the practicalities of rolling out the program? Where do the trainers come from and who's actually providing the services of the GLAD program?
So we certify clinics and individuals across the country to provide the program. The program has three components. It has education, so 2 education sessions, 12 interactive exercise sessions over a period of 6 to 8 weeks, and then an outcome measurement system. So the outcomes are measured at baseline, at 3 months, and at 1 year after participation in the program. So what we're really looking for is the clinics where the program is functioning to help people change their activity levels so that they can perform their daily activities more successfully and stay more physically active because of that. So physiotherapists can take the program, kinesiologists, regulated kinesiologists, chiropractors, any individual with scope of practice to include exercise and change in biomechanics for exercise. And so those are the professionals. Also, there's a designation called CSEP, exercise physiologists. So we're seeing the program launched in physio clinics, chiro clinics, but we're also starting to see it launched in some wellness centres and fitness centres, so that we can target those individuals who are very early in their osteoarthritis and are starting to get some very intermittent symptoms and would like to know more about the disease and control the disease at that point in the disease progression.
That's really interesting information. To be clear, are we talking about hip and knees, or just knees or just hips?
So hip, it has been shown to work for hip osteoarthritis and knee osteoarthritis. So it can be both, it can be one or the other. But yeah, it's a program that really targets stability and what they call neuromuscular control, and so movement patterns of the whole lower extremity, which is why it has its benefits.
Yeah. And the exercise program consists of what?
So the exercise program consists of 4 components. One of them is strengthening, one of them is what they call core, which is abdominal muscles and positioning. One of the components is knee over toe, or very much around keeping good body alignment. And then the final component is putting it all together in function. And so looking at some of the functional tasks that people with osteoarthritis of the knee and hip often have difficulty with, for example, getting up and down from a chair or going up and down stairs, and really targeting good functional muscle control in those activities, which is why we see the ongoing sustained outcomes for the program at 1 year.
And how do potential participants in the programme learn about it? So there's a lady, let's say she's got knee osteoarthritis. How does she hear about the programme and get involved in it?
So at the moment we have clinics launched in Ontario and in Alberta. As I mentioned, we're launching in British Columbia. We're also launching it in the Atlantic provinces and Newfoundland later this year. And to find out the locations, you would go onto the GLAD website, which is gladcanada.ca, and you'll see a tab there for locations. You can click on there, and it will the website both provide you with information about the program and specifically the locations in your area. You can go to your family physician or to your referrer if you're with a nurse practitioner or another referral agency, and asked for a referral letter or for the program. In a wellness centre you can attend. It depends on how your relationship with an ability to access care. But wherever there is a program, you can talk to them and they'll give you the specific logistics of how to actually get into the program.
And will healthcare providers broadly know about the program so they can refer their patients there if they think it's appropriate?
So now that we're starting to have programs open up across the country, I can't guarantee that healthcare providers will know about the program at the moment, but over the next year we're going to be doing a lot of work with the different healthcare communities to let them know about the benefits of this program.
Oh, that's wonderful. Let's just check if there's any questions from the audience. Perhaps we can see if there's any questions.
So someone wants to know how long is the program and what is the time commitment expected from the patient? Is it something that they can stop when they want, or they can stop and pick up where they left off?
So the overall time commitment is 2 education sessions and 12 exercise sessions. In order to see sustainable change, you have to do those in a period of 6 to 8 weeks, so twice a week. Once you have done the program, there is no requirement to carry on with specific exercises. As I mentioned, the program is based on changing functional movement patterns, and so you're encouraged to carry on with your normal physical activity and do these functional movement patterns in your everyday activity. But you do need to go through that 12 sessions in order to see the sustainable outcomes.
Let's just clarify what the objectives of the programme are. A participant enters the programme, what are they trying to achieve by being on that programme?
So the symptoms of osteoarthritis are often pain and disability, a reduction in functional activity and physical activity levels. And so the goals of the program are going to be dependent on the experience of each individual participant. But from the perspective of the healthcare provider, we are trying to maximize or optimize the functional tolerances of the individual, and to do that in considering their pain, so to reduce their pain.
To reduce their pain.
The outcomes that we know from the research in Denmark is that this reduces pain, it increases physical activity, and it has shown to increase people's ability to return to work, reduces medication use, and these outcomes have been sustained over a year. So it is something with long-term benefits.
Historically, people with hip and knee pain have been very quickly referred for surgery. Is this an attempt to delay surgery? Are there any statistics around that as far as the GLAD program as it operated in Denmark is concerned?
So there have been people that have been through the program who have chosen not to immediately go on to surgery, but the outcomes there is not sufficient numbers of people to actually say whether that's significant at this point. But we do know that even in Ontario with the program, we have had a couple of people already through the program that have chosen not go through surgery, but to delay their surgery.
Right, I see. Are there any further questions, Anita, before we wrap up?
Yes, I actually found one. How long, it was a question from a professional, who said how much do they pay to be trained and how long it takes, and is there a franchise fee? Like, is this a franchise training or?
So the costs are, it's a 1.5 day training program, and that gives you specific training on the GLAD program. It also, after participation, when you roll out the program in your clinic, you have to do outcome measures. And so there's, as well as the training, you do get assistance in being able to put the requirements in place for that, and we will also help you launch the program in your clinic. So the fee is $420 across Canada. It is subsidised in Ontario, and it's $300 in Ontario. If you are interested in participating in any of the training, then if you go onto the GLAD website, it will tell you the locations of the training programs that we're hosting over the next few months, and you can actually register directly on the website.
Perfect. I'm sure the one's right.
And just one last one. Are there any differences between the Denmark program and the Canada version of the program?
No, our licensing agreement requires that we replicate the program. And so the components of the education, exercise, and the outcome measures are the same. There's a few differences. English is a second language over here. They don't have some of those issues in Denmark, so there are a few differences. But the overall focus and components of the program are exactly the same.
Well, thank you very much for coming in and giving wonderful answers to those questions and informing us all about GLAD. Thank you very much.
Thank you. Thanks for the chance.